Assalamualaikum and a very good morning to Puan Saliza and to my fellow classmates. Today, I, Hazira, am joined with Ms. Laiha as your moderators for the third series of this Young Doctors Forum. This topic is still similar to the recent forum, diseases that are related to digestion.
We're joined today with five different doctors that was given different diseases to be researched and presented.
Starting off with Dr. Nazifa with gastritis, Dr. Lena with gastric bypass, Dr. Gashini with colorectal cancer, Dr. Nakiba with acid reflux, and Dr. Dini with pica.
Please also be aware that we don't have that much time to spare, so without further ado, I welcome the first doctor, Nur Nazifah, to talk about gastritis.
Okay, so hi, Assalamualaikum and good morning, Teacher Saliza and my beloved classmate. My name is Nur Nazifa, and today I will be talking about gastritis. So, what is gastritis? Gastritis is actually a condition in which the epithelial lining in our stomach become inflamed or damaged by gastric juice. As we all know, parietal cells secrete hydrochloric acid, which is a gastric juice, to digest food in our stomach. And mucous cells secrete mucus to protect the stomach wall from the reaction of hydrochloric acid and digestive enzyme. So how do you know if you have gastritis and what are the symptoms? So the first symptom is bloating. Bloating is when your belly feels swollen after eating. Other symptom is nausea, is when stomach discomfort and the sensation of wanting to vomit. Other than that is loss of appetite when you don't feel like eating. And then stomach ulcers when your stomach lining become irritated or inflamed. And other than that is upper abdominal pain, which is in Malay we call it sakit perut lah. Okay, and other than that is lastly is vomiting blood. Okay, so what are the causes of gastritis? First of all is keeping meals. Like all of us, we love to skip breakfast, right? And when our stomach is empty, a bacteria will end up going in and it will cause a bacterial infection. And the specific name for the bacteria is H. pylori bacteria. People who have gastritis usually it cause of H. pylori infection. And H. pylori bacteria can also causes stomach ulcers. Other than that is excessive intake of alcohol or painkillers when you drink too much alcohol or you eat too much painkiller. And then eating irregular quantities of food at irregular hour. And then smoking. The nicotine in the smoke increase the acid secretion. So when we smoke, the parietal cell will secrete more hydrochloric acid. And then lastly is medication. If your parents have a heart disease, they are using aspirin to treat their heart problem. But there's the side effect of the drug. The drug irritate your stomach lining. So usually doctor will give your parents aspirin and other medication to protect your stomach lining. So how to treat gastritis is based on how it causes you to have gastritis. For example, you have gastritis because of H. pylori infection, you have to take antibiotics because antibiotics help you to treat H. pylori infection. And other treatment is by taking antacid, for example, Gaviscon. Antacid reduce stomach acid exposure. Okay. Other treatment is by taking histamine. Histamine, it will decrease the production of stomach acid. So when you eat histamine, your parietal cell will secrete less hydrochloric acid. And lastly is proton pump inhibitors, which is the same function as histamine to decrease the production of stomach acid. And proton pump inhibitors can also treat stomach ulcers. Okay, so what are the risk factors? Is drinking high amount of alcohol, eating unhealthy and spicy food. So if anyone here love to eat spicy food like samyang, you can eat spicy food, but don't eat too much spicy food. Okay, and then smoking and having a history of viruses. So what happened if you left your gastritis untreated? So if your gastritis is causes from H. pylori bacteria, it will cause gastritis ulcer. And when you don't treat your gastritis ulcer, it will be inflamed, and it leads to stomach cancer. Other than that is anemia. Gastritis, sore in your stomach that bleed. Thereby, it will lower your red blood count. And lastly is pernicious anemia. Actually, gastritis can affect how your body absorbs vitamin B12. So pernicious anemia is when your body don't absorb enough vitamin B12. So the function of vitamin B12 is to produce a healthy red blood cell. So yeah, I think that's all from me. Do you guys have any question? Betul ke kalau kita ada gastric tak boleh minum susu? Susu, actually susu dia punya sifat is quite acidic. So dia akan like inflame our stomach juga. Sebab dengan hydrochloric acid lagi, so yeah. Does drink lemon juice worsen the gastritis patient? Yeah, because it's acidic.
Okay, I have one question. Can gastritis cause death?
Yes, my answer for that question is yes, if you left your gastritis untreated. Actually, my great-grandmother died because of gastritis, actually stroke, but it caused from gastritis. Because at first she have gastritis because of genetics. Her epithelial lining is thin, and then she always skip meals. So, but she doesn't know that it's a serious gastritis. So, end up she have anemia, and then less oxygen transferred to brain. Then she got stroke, and yeah.
I'm so sorry for your loss. Okay. Thank you for the informative presentation. So moving on.
Last
Sorry?
the video.
Oh, the video. Sorry. Okay.
Hi, Teacher Saliza, and hi, friends. My name is Nur Nazifa, and I am from 4 Nebula. And today we have a special guest, and she is a third-year medical student in University of Cyberjaya, and her name is.
My name is Marzatul Izana Suha binti Arifai, but people call me Iza, and you can call me Iza as well. And like you said, I'm from University of Cyberjaya. This is my 3rd year. Actually, I just finished my 3rd year. Moving on to 4th year, inshallah, in October.
Today, we're going to talk about gastritis. So, Kak Iza is going to explain to us about gastritis, okay?
All right. So today, I'll be explaining a few components of gastritis. I'm not going to talk in detail because I'm not sure if it's your level, but I'm going to try to explain it the simplest way possible so that you can understand. Usually in medicine, we will learn, if we learn about the disease, we will learn about the definition, the epidemiology, the etiology, the pathophysiology, the pathogenesis, the risk factors, everything until treatment, management, and investigations. But I'm not going to touch like everything on that. I'm just going to touch only a few things. Okay, so what is gastritis? So gastritis, according to Kumar and Clark's clinical medicine, it is, the definition is an inflammation of the stomach mucosa. Okay, if you can see here, gastritis indicates inflammation associated with mucosal injury. This is actually a really, really medical definition. But to put it simply, gastritis is the inflammation of the stomach mucosa. In medicine, everything ends with itis is inflammation. So that's like a medical term that you have to know. So gastro or gastric is stomach, itis is inflammation. So gastritis is inflammation of the stomach. Specifically the mucosal lining. If you can see here, I include a picture. This is the stomach, if you guys can see. In the stomach, we have like a lot of linings. This is the outer lining, and then this is the muscle, because our stomach is actually a muscle organ. Okay, and then we have submucosa. But the problem in gastritis is that the mucosal part here is inflamed. Okay, so that is the definition. Your next question is, what is the best way to prevent gastritis? There's not only one way, but the easiest way is to stop what causes the gastritis. For example, if you're smoking, you have to stop smoking. If you're drinking alcohol, you have to stop drinking alcohol. Like if you're taking aspirin or NSAIDs, okay, for example, aspirin is like um, an essential drug for the elderly, for example, because they have heart disease. The doctors will always give another drug to protect the lining. We call it antacid. Antacid is a drug that helps decrease acid secretion. So it's like a balance defensive and damaging forces. Okay. Another one, okay, this picture is actually, and also, like I said just now, H. pylori infection if they skip meals. So don't skip meals. Okay, so like that's the easiest. Another one will connect us to the next question, which is stress. Okay, you asked whether stress, okay, stress is all in the mind. It can't make you physically sick. Is this statement true? Okay, in medicine, no, it's not true. Everything, not just gastritis, stress can lead to a lot of problems in our body. It leads to a lot of impairments in our physiological process in our own body. So no, that statement is not true. Stress does cause gastritis, and I'm going to tell you how. So this is a nice, simple diagram that I can show you how stress can cause a lot of things in our body. So what is cortisol? Cortisol is the stress hormone. When we're stressed out, maybe because we stay up too late, there's a lot of mechanisms of how we became stressed, right? Like as a student, we sleep late, we think a lot about our studies. So we will release a lot of cortisol. Cortisol is a hormone, a stress hormone. Okay, and what it does, a lot of things. It does a lot of things, which includes digestive issues. Like we're talking about digestive system, right? Just now, like the stomach. And how does cortisol affect our digestive issues is the cortisol will increase the acid secretion, like I said just now. It's supposed to be balanced, acid secretion and our defensive forces. But what cortisol does is it increases acid secretion. So when the acid secretion is increased, it increases irritation to the stomach lining and it increases inflammation. So yes, stress does cause gastritis and it causes a lot of other diseases. But now we're talking about gastritis, so yes, it does cause gastritis. Yeah, so I think that's all for the questions that you asked me. I tried to prepare like a simple explanation.
Okay, so I think that's all for our interview for today. And do you maybe have something to say to my classmate that maybe want to be a doctor just like you soon?
Okay, so you guys are Form 4, right?
Yeah.
Okay. So there's a long way to go. It's normal if you don't have any ambition yet, just like me when I was in Form 4. But if you already know that you want to become a doctor and you are passionate, then just go for it. Even though it's going to be hard, you know how people say medicine is going to be hard. The system right now does not appreciate doctors. That is not your place to worry about yet. Your main focus, your main goal right now as a Form 4 student is studying very, very well to excel in your SPM subjects, especially the science subjects, so that you can get into a good med school. I mean, all med schools are fine, but if you can get into the best med schools, then that's like rezeki for you lah. So don't give up too early. My tips as a Form 4 student is always help your friends with studying. Jangan kedekut ilmu lah. Yeah, that's my advice for people as general, like for people in high school in general. But to those who wants to become a doctor, I really hope we can work together in the future lah. Yeah.
I see, okay. But before I end this interview, I would like to say that I sincerely appreciate you and thank you so much for your time. Thank you so much, Kak Iza, and goodbye, friends.
Bye-bye.
Okay, so that's...
Next, welcome Dr. Elena to talk about gastric bypass.
Hello and a very good afternoon. I will be presenting about gastric bypass. So, what is gastric bypass? No, wait. We'll talk about obesity first. It is a health issue on the rise throughout the world, and although obesity can be controlled through diet programs, at times obesity requires medical treatment. Specialist doctors may suggest surgical procedures to reduce body weight, such as gastric bypass. A gastric bypass involves a reduction of the stomach size using various methods of surgery. Uh, before someone needs to do a surgery or a gastric bypass, you first need to do all sorts of it's like a last resort kind of thing to reduce weight. So you gotta put effort in trying to lose weight on yourself first before going straight to surgery. It is done to reduce life-threatening weight-related health problems such as heart diseases, high blood pressure, obstructive sleep apnea, and gastroesophageal reflux disease. It is usually done for individuals with a BMI of 40 or higher with extreme obesity, or a BMI of 35 to 39.9 with serious related health problems. What are the risks? It is divided into short-term and long-term. In the short-term risk, acid reflux, nausea, vomiting, expanded esophagus, certain food prohibitions and risk of infection can occur. In the long run, you may have dizziness, low blood sugar level, malnutrition, stomach ulcers, and defecation problems. In the end, patients will get results such as long-term weight loss and possibility to lose about 70% of your excess weight within 2 years. Will also improve or resolve conditions related to being overweight, including stroke, infertility, high cholesterol, type 2 diabetes, and gastroesophageal reflux diseases. It also enhances your ability to perform routine daily activities and quality of life. As seen in the picture, that is how the surgery looks like before and after. They will cut out a part of the stomach and create a smaller section and connect it to the duodenum below there. You can also look at in the textbook page 161 for further information and more detailed picture of the surgery itself. I think that is all. Any questions?
Sorry, Mr. Okay.
I have a question. Is the weight loss permanent?
Yeah, it is.
Okay.
Okay, I also have a question. Does gastric bypass put your life at risk?
It does because for some people, because the part where they cut out and stitch the part of the stomach, it may leak and cause internal bleeding, and it will also which will lead to bigger problems. And it could also have the risk of doing surgery and the short-term, long-term mentioned before.
Okay. Thank you, Lena.
Welcome.
All right, moving on. Next, I welcome Dr. Kashini to talk about colorectal cancer. Okay, I just texted Kashini, dia cakap suruh proceed dulu, nanti dia akan present. She's having technical issues. So with that, I welcome Nakibah, Dr. Nakibah with acid reflux.
Hello and good afternoon to Puan Saliza and my fellow classmates. Today I'm going to be explaining about a digestive disorder called acid reflux. And reflux means flowing back. So firstly, what is acid reflux? Acid reflux means that you have a reflux of stomach acid from the stomach up into the esophagus. This occurs when the gastroesophageal junction is in the wrong position and therefore cannot close tightly. Stomach acid can then leak out. Gastroesophageal junction is the point where the distal esophagus joins the proximal stomach, and it is commonly exposed to GERD. GERD is gastroesophageal reflux disease. So roughly speaking, when you swallow food, it goes through your esophagus, then into your stomach. Um, there's a muscle at the bottom of your esophagus that is called lower esophageal sphincter, and when proton pumps release acids to help digest food, LES is designed to close tightly after swallow so nothing can come back to esophagus. A small amount of reflux doesn't cause any harm, but esophagus can be damaged if acid splash on it over and over again for years. This is because the valve become weaker so it's unable to close tightly. The valve is the sphincter. So different types of acid reflux. We have GERD, which I already said earlier, silent reflux, LPR reflux, heartburn, and Barrett syndrome. Moving on to symptoms, we have heartburn, chest pain, draft cough, nausea, acid regurgitation, which is when contents from your stomach move up into your esophagus, thick and bubbly saliva, pain in the upper part of the abdomen or belly. Causes of acid reflux is eating large meals or lying down right after a meal, being overweight or obese, eating a heavy meal and lying on your back or bending over the waist, snacking close to bedtime, eating certain foods such as citrus, tomato, chocolate, mint, garlic, onions, or spicy or fatty foods, drinking certain beverages such as alcohol, carbonated drinks, coffee or tea, smoking, being pregnant, taking aspirin, ibuprofen, certain muscle relaxers, or blood pressure medications. Aspirin and ibuprofen is a medication used to reduce pain, fever, or inflammation. So the treatments. Over-the-counter medications, we have antacids that neutralize stomach acid, medications to reduce acid production, medications that block acid production and heal the esophagus. For prescription medications, we have prescription strength H2 receptor blockers, prescription strength proton pump inhibitors, which is the medicine that works the best, and medication to strengthen the lower esophageal sphincter. For surgery and other procedures, we have fundoplication. Fundoplication consists of three types, which is the open fundoplication, laparoscopic fundoplication, and hiatal hernia repair. For LINX device consists of a series of titanium beads, each with magnetic core connected together with titanium wires to form ring shape. It is implanted around the lower end of esophagus. Then we have transoral incisionless fundoplication, TIF. TIF is an incisionless surgery procedure. It constructs durable anti-reflux valve, re-establishing a natural barrier to reflux. Then a natural healing process called serosal fusion occurs. Then lastly, we have preventions. It is to maintain a healthy weight, stop smoking, elevate the head of your bed, don't lie down after a meal, eat food slowly and chew thoroughly, avoid foods and drinks that trigger reflux, and avoid tight-fitting clothing. And that's it.
Okay, thank you, Dr. Nakiba.
Okay, I have a question for you as well. You mentioned yang weak sphincter boleh menyebabkan acid reflux. So, what causes weak esophageal sphincter? Sorry.
When a person overeats or is overweight, their stomach starts to swell and put a lot of pressure on the sphincter. And then over time, it will lose strength and shape. And that's it.
Okay. Thank you. Okay. So, is Kashini ready? Hello,
Hi.
Kashini?
Yes. Hello everybody. Today I will be talking about colon or rectum cancer. I won't be explaining in depth because my uncle is going to break it down very well for you. So here's just a little of what I have. Colon cancer is a type of cancer that begins in the large intestine. Here's a little diagram so you can have a little image of it. The colon cancer is the final part of the digestive tract. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as a small non-cancerous benign clumps of cell called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. What are polyps, you may ask? Polyps are a problem projecting growth of tissue from a surface in the body, usually a mucous membrane. Polyps can develop in the colon and rectum. The symptoms: a persistent change in bowel habits, including diarrhea or constipation, or a change in the consistency of the stool, rectal bleeding or blood in the stool, persistent abdominal discomfort such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely. The causes? It's funny how Google said that even doctors aren't certain what causes most colon cancers. Normally, colon cancer begins when healthy cells in the colon develop changes in the DNA. A cell's DNA contains a set of instructions that tell a cell what to do. The preventions and the risk factors. They're quite similar, but at the same time, it is quite different. So, lack of regular activities, a diet low in fruit and vegetables, overweight and obesity, and alcohol consumption. Preventions are get screened for colorectal carcinoma. Screenings are tests that look for cancer before signs and symptoms develop, and eat lots of fruit and vegetables daily. There are treatments that you have to go through when you have this cancer, which is surgery, radiation therapy, and some drug treatments that are chemotherapy, targeted therapy, and immunotherapy. There is also something called colonoscopy, but my uncle will explain it in the video. This is just an image to show you that that is a colon and that is a rectum, so it's two different places. Yeah.
Okay, you said you wanted to play your interview video?
Yeah, I'm gonna play that.
From the part of the intestine below the stomach until all the way to the rectum or anus. So it's a general term. Colon usually refers to the large bowel.
Yeah.
Okay. Rectum is the last part of the large bowel. So these terms are all used they are used quite interchangeably. So colorectal carcinoma in general refers to any cancers that come from the large bowel. Also, the large bowel starts from where the small bowel ends and then goes all the way. So there's a colon that goes up, across, comes down, and goes into the rectum and the anus. So any cancer that comes anywhere along this is called bowel cancer or colorectal cancer. The small bowel, as far as being the human, for whatever reason, very, very rarely has cancer. So surprisingly, all the cancers in the bowel is generally limited to the large bowel. So the large bowel, the other term, as I said, is a colorectal cancer. So you will hear many terminology. A layman may say bowel cancer. In medical line, you will say colorectal cancer. Yeah. It could be part of the colon or it could be the rectum. But if somebody asks specifically what it is, they can say, okay, it's a cancer of the colon or it's a cancer of the rectum. But essentially, if someone says I've got colorectal cancer, if you have two medical personnel talking, you can say, okay, specifically which part of the large bowel.
Okay.
Yeah.
Kind of.
So is that in bottom line is that the word bowel cancer, the bowel means is a very generic. It can be anywhere along from the small intestine all the way to the rectum.
Yeah.
Okay. But when you say use colon or colon usually refers to the large bowel. Okay.
Mhm.
Rectum is the last part of the large bowel.
Yeah.
When someone says colorectal cancer, they are referring to a cancer that's come up from anywhere in the large bowel all the way to rectum.
Okay. Is there any food that these patients should avoid?
Not necessarily. In general, they are able to, their appetite may be affected by the cancer,
Uh-huh.
by pain, and of course the treatment. If you had surgery or you've had chemotherapy, that might affect the kind of food you can eat,
Yeah.
because especially if someone's had surgery, they may not be able to tolerate heavy foods, example meat and lots of meat. They're probably better off taking a lot of high fiber food. But in general, there's no food intolerance. There's no food that you cannot eat for the sake of it. Is once you have someone's got colorectal cancer, it just depends on how much the person can eat, his appetite, and in general his appetite, or his whether he's had surgery, whether he's had chemotherapy, whether he's had part of his bowel removed because of surgery.
Mhm.
So that may influence the type of food he can eat.
Okay. Is there some other diseases that can influence this? Like some other problems that can affect it or cause it?
Cause bowel cancer?
Yeah.
Well, it's not related to other diseases as such. I mean, you are right. There's certain conditions, such as if you have little tiny growths in the bowel
Mhm.
called polyps.
Yeah.
Some people have polyps, and that can predispose, to cancer. Some of those polyps, some people can grow and change into cancer. So some people with polyps in their bowel can develop into cancer. Number two, there can some in bowel conditions called inflammatory bowel disease. There are two conditions one's called Crohn's disease and one's called ulcerative colitis. These two diseases are part of a spectrum called inflammatory bowel disease, and these two predispose or increase the risk of bowel cancer.
Okay.
Other factors, some are like gender, certain racial stereotype, and of course certain foods, such as people say that diet high in saturated fats, diet high artificial foods and sweeteners and preservatives, all these processed foods may increase the risk. They don't directly cause it, they increase the risk.
Okay. Okay, just 1 second.
You understand what's the term screening? Can you screen for bowel cancer? Basically, a screening test is a test where somebody said, look, how can we do a test that can increase the chance of us detecting bowel cancer even before it develops symptoms? Because the problem with bowel cancer is by the time you develop symptoms, it's a bit late. You would likely need to have big surgery, chemotherapy, radiotherapy. So for a long time, people have been thinking of is there a possibility or a role for a screening test? So for bowel cancer, especially in Australia, I don't know about Malaysia, the screening test that they use is anyone once they turn 60. The government will send you a form, 50. Once you turn 50, after you turn 50, they will send a form and a stool, basically for a stool test. they will ask you to send a sample of your stool
Mhm.
to the lab. Basically, the lab is looking for blood in the stool. It may not be visible to the naked eye, but in the lab they can look for it. And if they find blood, they will contact you, and then you see your doctor to organize a colonoscopy, which is basically putting a camera up your bum into your colon to look for cancer. And this screening test has been proven to increase the pickup of cancer, bowel cancer. Hence, we can save a lot of lives have been saved. But it's not a foolproof test. You can't detect all 100%. There'll be some people with bowel cancer who don't have blood in their stool. It's the blood. It's better than nothing, right? It's better than nothing. So in Australia, everyone after the age of 50 gets this test. So then after that, if it's negative, they usually do it every 2 to 3 years. They repeat the test. Some people who got very strong family history, because that's the other issue. If you got very strong family history of cancer or bowel or colorectal cancer, usually their doctors will tell them, look, usually it's good to get a routine, either even before the age of 50, test their stool for blood, and also maybe doing colonoscopies regularly, maybe every 2 to 3 years. So these are basically people who are higher risk because of their family history, or whether maybe they've got, like I told you earlier, inflammatory bowel disease, or maybe they've had a scope before that showed polyps, and hence they have been recommended to have regular colonoscopies.
Okay.
Wow, that was very, very informative. Thank you, Keshini. And thank you, Laiha, for sharing share screen.
Of course.
Okay, is there any questions for Dr. Keshini? Okay, I have a question.
Okay.
Anyway, so what are the odds of beating colorectal cancer?
For colon cancer, the overall 5-year survival rate for people is 63% only. Yeah. And there's a 91% survival rate for diagnosed cancer at a localized stage. And a 72% survival rate between 5 years.
Okay. Thank you. So, well, I think this has been very beneficial for all of us. All right, with that, I welcome Dr. Dini to present about PICA.
Assalamualaikum and good afternoon. Today I'm going to talk about PICA. What is PICA? PICA is an eating disorder in which a person eats things not usually considered food. The symptoms of PICA are stomach pain, fatigue, constipation, and nausea. The causes of PICA: the first one is those with malnutrition or suffer from hunger, resulting in low level of nutrients such as iron and zinc. Second one, mental health conditions. The third one, developmental disorders. And the last one is stress. PICA treatment or prevention. The treatments are family education and mental health counseling. The prevention, remove items from the surroundings. The risk factors are hair pulling disorder, trauma, skin picking disorder. The myths and facts of PICA. The first one, the first myth is childhood disorder, but the fact is can occur at any age. The second one, consuming odd foods. The fact is a person with PICA eats non-food items. The third one, people with PICA consume similar items. The fact is people with PICA consume many different types of items. The last one, PICA and pregnancy cravings are the same. But the fact is Pregnancy cravings are typically for food items, while pica is the craving and consumption of non-food items. That's all.
Okay, thank you, Dr. Dini. Are there any questions? Okay, if tak ada, I have a question. Oh, sorry. Okay, Laiha, you go first.
You go first.
Okay. Haiwan pun boleh ke kena pika?
Boleh. Another like cats and dogs.
Okay, the question from me. You said a person eats things not usually considered food. What are some of the example of the food that is not considered food?
Like clay, dirt, ice, pepper. Yeah.
Wow. Okay. Thank you.
Okay, so time to wrap this up. Thank you to all the young doctors. Thank you for cooperating.
Until next time.
Bye.